We continue our coverage, COVID-19 coverage. Let me bring in SABC news reporter Makgala Masiteng. She's live for us in Bloemfontein. Makgala, very good morning to you. So we know that there's a cohort of 18 years and over eligible now to get the COVID-19 vaccine. What's the feeling, the tone and tenor where you are? Are people eager to get the jab?
Good morning, Blaine, and good morning to the viewers. Yes, from yesterday we have seen those between the ages of 18 to 34 actually coming forward, coming out in numbers, specifically here in Bloemfontein. So today we are in Pahameng, in KLK car wash. This is where the department is stationed for today. They will be vaccinating some of the youth who will be coming in to this area. They are saying that they will be targeting such places to ensure that they do get young people to get vaccinated, and they are starting today with KLK, and in the coming weeks they will be going to different areas. But I am with MEC of Health in the Free State, Muntensi, just to take us through this plan of them to make sure that they increase even the numbers of people who get vaccinated daily. MEC, thank you very much for joining us. Why specifically have you chosen such places like KLK?
We know that during the weekend young people want to go to places where they are going to enjoy themselves and relax, and we said, because we can't wait for people to come to us to get the vaccine, let us go to the people. Whilst we were doing with the elderly, going out to where they stay, we thought during the weekends we know that young people come to the car washes, they go to the places where they're going to enjoy themselves. So we are here, and they have already started vaccinating, registering and vaccinating. We are doing something that they enjoy. We have our program for today. We have joined a program with Sapa Yoga Bikers Club and the KLK Car Wash and Chizanyam, because they've got a program that they are doing. They are giving schools, the young kids, they are giving out school shoes. They are giving an orphanage. They are offering them mattresses. They've donated mattresses for them. Then, other than that, we know that KLK is one popular place here in Pahameng, in fact in Mangaung. So we know that young people will be here. We are going to be giving them vaccines, also teaching them how to take care of themselves, how to stop the spread, about the non-pharmaceutical protocols.
Well, MEC, we do know that so far you have vaccinated over 500,000 people, and the target is 1.9 million. With the addition of the cohort of 18 to 34, do you think you will be able to reach the target that you have set for yourself as the province?
I believe we are on course, because remember the target for Free State is 1.9 million. If we are already above the 500,000, that says with the addition of the 18 years up to 34, we are going to at least go closer to 1 million. Then we'll be left with 900,000. As long as we go to the people, we actually have said, let's do something different. We are not going to stay in our vaccination sites and people do not come and then we think it's okay. We are going to go to the people, even go to the door-to-door, because we also have vaccine carriers where we can take the vaccines into the house and vaccinate somebody inside the house. So we are really going to target such places during the weekend in Bloemfontein. We know that if people are not here, they are somewhere in 2nd Avenue in town. So we are going to go there and make sure that we have our pop-up vaccine sites and make sure that we administer vaccines there. And so get into the target, we are on course.
So just briefly, just to finish this interview, we have seen the number of infections increasing, especially in schools. What have you found out about it? What is the problem there, especially in Mangaung? Because I know several schools have been closed because of infections.
Most of the schools that have been affected is the schools that have hostel. For an example, the Grey College. We know that we have kids that come outside the province, and because they stayed together in the hostel, they infected each other there. Our people, our healthcare workers, went there just to talk to the principal and the people that take care of these kids, that they must make sure that even in the hostel, children continue observing the non-pharmaceutical protocols and they continue wearing their masks. It's not just because they are staying together, they must take off their masks and, behave as if nothing is happening, especially because they got infected when they came from home when the schools opened. So it has spread throughout other schools, and we are also tracing the contacts to those that are staying at home, because there are those that have been infected in school that are not staying in the hostels. So for us to stop the spread is to contain the infection, is to make sure that we get the close contacts, test them and isolate them where necessary.
Thank you very much, MEC, for that interview. I'm going to move to some of people who have come to this area to get vaccinated. The gentleman next to me actually works just opposite this place, so he came to vaccinate. How was this of assistance to you? Because I see you are still at work and you managed to come and get vaccinated.
Yeah, I have to admit it's a good one from our health department, because it's very easy to get vaccinated in kind of this manner. Like our sister just told us, I'm working nearby, so it was going to be difficult for me to go to hospitals in order to get vaccinated. So through this whole adventure of our health department, it's convenient and simple. Thank you. Thank you, Mama.
Thank you very much. But the importance of being able to vaccinate, just a message to other young people, for them to be able to come and get vaccinated.
I think through such adventures from our health department, it shows that our government cares about its citizens, because they're bringing the service to us, closer to us, and then most of young people are unable, they don't actually care about going to hospitals and registering and all that stuff. But through such adventures, it becomes easy, and it shows that our government really cares. So it's up to us that we get vaccinated. Now I just got vaccinated and there are no impacts that I'm feeling. I'm still on duty and I'm still performing as well as I started. Nothing is different.
Thank you very much. I've just called a lady who is busy with registration. I know I caught you off guard, but how are you feeling? I see you are here. You want to get vaccinated?
Yes. I'm very excited. All the time, I was so afraid to get a vaccine, but now I feel free because I'm sick. There is nothing else I can do.
Do you think this assisted you, that they came closer to where you are living, where you live?
I think so. What can I say? I think so. What can I say? There is no more I can say, because everyone who don't want to vaccinate is up to her. So me, I'm fine.
But you didn't register before, you just registered today?
No, I didn't register. I just registered today. Yes. I found out so that there is a vaccination here, so that I said, oh my God, I didn't have a ID number. So let's go and ask if they can help me. So I'm here. I'm fine now.
Thank you very much. You can go back to where they've been assisting you. Blaine, this is just briefly some of the people who have managed to come to this area to come and get vaccinated. As you have said, the lady, she was not even registered to get vaccinated, but when she heard that the department is here vaccinating people, she took that opportunity and came here to get vaccinated. As you can hear even at the background, this is a very noisy place. This is a place where people, especially young people, always gather. And I've heard from some of the health officials here that they have come with about 200 doses for today to make sure that they do vaccinate the youth who are coming to this area. As you can see behind me, this is the station where the Department of Health is based to ensure that they do vaccinate people and young people specifically who have come out here, whether being they have come here for entertainment activities. So they are here to ensure that they will be able to get those young people get vaccinated. And this is where the department is based. And they have told us already that they will be moving to these entertainment areas where young people always gather. And Blaine, remember that the social gatherings have also been a problem, especially in Mangaung, which is the economic hub in the Free State, where we do know that entertainment areas are many in this area. So they are targeting specifically those areas to ensure that people do get vaccinated, and besides that, to ensure that people do adhere to COVID-19 protocols while they are enjoying themselves, and also be able to get vaccinated, be safe, and be able to get the entertainment side. Blaine?
Yeah, this is what the scientists tell us, isn't it? The people in the know, that we need to follow the non-pharmaceutical measures, wearing a mask, washing your hands, watching your space, but also get the vaccine. That's what they tell us. But there are people out there who are concerned with regards to the vaccine, Makgala. And as I promised earlier on, we're going to bring in the experts in order to allay some of the fears, get you the facts on the ground, so you have this confidence to get the vaccine if you do so choose to get the vaccine. Makgala Masiteng, live for us in the Free State. We thank you very much indeed for your time. Look, one of the ways that